Have you or anyone that you know been struggling with suicidal tendencies in this time? Stay tuned for this next video because Dr. Cath is going to be discussing the issue of suicide prevention. Although it's not super in-depth, she'll be able to give you some tips if you're either struggling in this area or you know someone who's struggling in this area. Additionally, down below in the description box, there are resources that are listed that we would strongly recommend that if you are struggling with suicidal tendencies or you know someone, that you seek additional help. If you want more information on more mental health videos, please subscribe to this channel, and we hope you watch this informative session with Dr. Cath.
And now a word about suicide. This is the hardest one. It is, by statistics, the one that psychologists lose sleep over. We just feel the weight of a life that depends on us. Because we need to attend to others' safety and their care. First thing I want to address is some of the myths that we have around suicide. We tend to think that talking about suicide is going to make somebody feel more suicidal. That's actually not the case. I have talked to countless people and asked the question about suicide. And there's been only one time where the person came back and said, that made me feel awkward. Otherwise, people can just tell me straight up, no, not even thinking about it, or I've got some thoughts around that. Then we can have a conversation around it. So talking about suicide isn't going to make them suicidal. In fact, to take that a little bit further, talking about suicide with somebody can be the first step toward preventing suicide. We'll put it out in the open. Let's talk about that. Let's figure this out together. We need to remember that suicide isn't so much about ending life. It's more about getting relief from pain. So I want to be aware of that when I'm talking with somebody who's struggling with this. And the fourth thing that I want to say is that we all have a role to play in preventing suicide, in caring for people at that crucial time when they're just feeling like they can't do it anymore. So here's some communication principles. Not so much words I want to give you, but principles to think about when you're communicating with somebody who might be struggling with this kind of thinking. The first thing is being empathetic. I've talked about empathy quite a lot. I've talked about how healing empathy can be, or how it opens up a space or an environment where a person is more willing to move forward and grow and make positive steps. Empathy. Listen to their story. Just hear them. We don't want to coerce them into anything, and we want to be respectful. I just hear you. Non-judgmental. There's that word again. I don't want to judge you. You don't want to be judged by me, and I'm not supposed to judge you anyway. I also don't want to try to manipulate you into doing something that I want you to do. I want to help you figure out how we can get through this better, and preferably together. So that's the first communication principle. Empathy. The second one that's really important is collaboratively. So I'm not going to tell you what to do. I'm not going to tell you what to think about. I'm not going to tell you how to get over it. I'm going to co-author with you. So we're going to figure it out together. So let's talk about what is creating this pain that you don't want to live in anymore. And let's co-author the story as you move forward. What can we do? How can we find some spaces that are going to work better for you, feel better for you, help you to be healthier? So I collaborate with you. That's the second communication principle. The third one is be straightforward. Here's what I can do. I cannot follow you home. I can be here to read your text tonight at 7 o'clock or whatever, or tomorrow morning at 8 o'clock. This is what I can do. This is what I cannot do. I can be here to care, but I can't come to your house during this season. But I sure do care. You can call me. I can call you. That's what I can do. This is what I cannot do. I want to be clear on that. So empathetic, collaborative, and straightforward. Here's some things. So if somebody is hinting around, so I'm just not sure I can do this anymore, I'd just like to end it all. Somebody's saying something like that to me, and it's just sounding like they might be thinking about suicide. I'd be just back to them saying, that sounds like you're thinking about taking your life. Is that right? If I get a yes, I'm thinking about it, then I want to understand how they're thinking, because there's different levels of concern. So I want to know what their thoughts are. Sometimes people just are thinking, I just don't want to do this anymore. I can't do this anymore. But they're not thinking about what they would do. They're just thinking, I'd rather not be here anymore. That is less concerning, still worth our attention, but not as concerning as if they actually say, I actually am planning to do this. If I'm hearing a plan, this is what I'm going to do, this is when I'm going to do it, and I plan to do it, my intention is to do it, then I'm getting more concerned, and my desire to create safety is going up. I'm paying close attention to their words. Those are things that I want to pay attention to. I also am interested to know if they've ever done anything before. Is this a brand new thought? Is this something that's come up for you before? So those are all things that I want to pay attention to. I just want to take a moment right now and just say, to be well trained to deal with suicide, you're not going to get in the next 5, 10, 15 minutes. I cannot give you a good course on suicide in that amount of time. To get a good course on suicide, if that is coming to you and you want to be able to handle it well, you can do a Google search for ASSIST, ASSIST, and you can do a 2 or 3 day training. I forget which it is, 2 or 3 days, and that will give you some good training that you need. I don't know what the qualifications to get in are, but if you want to get trained, that is the direction that you want to go. And there's different agencies around Edmonton that do that. But this is to help you to be a friend, a pastor, a caregiver of some kind, and know how to handle it when it comes to you. And I'll talk about how to send them further for skilled help as well at the end. To help you further, we will put a link in the screen below this so that you can actually know where to go if you want to get that good suicide training. All right, here are some things that can be helpful as you're talking to a person that is struggling. Help them figure out some coping skills. So in a previous session, we talked about different ways that different people cope. And by listening to that session, you can hear a number of coping skills and a number of styles of coping that they can use. And you can talk back and forth together. How do you cope? How have you gotten past this before? How might you be able to do that? And you might even talk about something that you've done. But you are most interested, 98% is about what they need to do, helping them figure out what they need to do. So coping skills can be helpful. As one person said to me, we can't necessarily make our jobs smaller, but we can make our shoulders bigger so that we can shoulder those loads. There are things that we can do to be able to handle things and the things that are on our plate. So even in the face of COVID, there are things that we can do to increase our coping skills, which increases our proverbial shoulders so that we can handle this greater load that we're going through right now. Another thing that can be helpful is connection to others, family, community. And again, that right now, in this day and age with COVID around, that might be phone calls. That might be daily phone calls. That might be several times a day phone calls or video conferencing. Connection to others. You might not be able to connect the way that you want, but how can you connect? How can you make this work better? So figuring out ways to connect with other people right now is really huge. Access to physical and or mental health care. So remembering that our physical wellness also impacts our mental wellness. Having access to physical care and mental care or mental health care is really helpful. And the fourth thing that can be helpful is faith. Having that greater someone that can take care of me is a really helpful thing. And again, that leads us back to that resilience. Resilience actually inoculates against stress. We talk about, right now we call it a vaccine, but a vaccine is an inoculation against COVID or against the flu or whatever the vaccine is for. It inoculates us for when those things come. So when I choose commitment, have a sense of control, see things as a challenge rather than a threat to my well-being, that actually is an inoculation against stress that is inevitable to come. All of those things are helpful for that one that is struggling with suicidal thinking. So, important to communicate well, important to be aware of things that can help that person who's struggling with suicidal thinking. We also need to think about safety. To help with safety, first thing I want to do is I want to talk through with them their reasons for living. So a person one time said to me, my son has all that he needs. He's got money in the bank, he's got a wife, he's got a kid, he's got this, he's got that. They don't need me, they'll be fine without me. Not true. You cannot be replaced. There is a reason that you want to live. You want to draw on their protective factors. It can be family, it can be a job, it can be an animal. I have seen lots of situations where an animal has been a protective factor. Whatever their protective factors are, that's people, animals, those kind of things. Draw on those as you're talking about why they need to live, why we need them to live. Second is help them to create a list of their resources. So what do they have? We can often have resources around us and not even be aware of it. So are there other people in their life they can actually enlist that are going to help to care about them? So maybe they have aunts, uncles, cousins, friends that they're not calling. Bring that into their awareness. Get them talking and thinking about that. Oh, that's right. I never even thought about calling my aunt. She's always there for me in the past. So draw on their resources. Help them to create that list. Give them crisis contact numbers, and that is going to be in the screen below and in the last slide. So give them crisis contact numbers that they can reach out to. Those numbers are 24/7. So they can text out, they can call out at any time of the day, any day of the week. Give them those numbers and consider the professional resources. Do they need to go to a hospital? Should they go see a counselor or a psychologist or their pastor? Those are a couple things helping with safety. Other things to help counteract the risk factors. So encourage those coping skills. So what do you do that just makes you feel content? We're back to that question again. And encourage them to use those coping skills. What can you do? Somebody's really depressed. I can't even face exerting myself in exercise. What can you do? Well, I can take my little black fluffy dog out for a 10-minute walk. Okay. Encourage it. Make it doable. Help them to make it doable. Draw on what they know, what they've done before. Help them do that. Reinforce connections. So where are you connected? How do you rebuild that connection? Are you a connection? Are you going to stay there? Can they keep talking to you? Reinforce connections. Remove the person's means if you're able. So if somebody is talking about taking a pill of sleeping pills or a bottle of sleeping pills or this medication or that or something, whatever it is, the means is the way that they would do it. Remove that. I have seen people put it into a safe that belongs to another person in the house and they don't know the combination to the safe. I've seen that you can take guns out of the house. You can, whatever the means is, you can take it away. I've actually seen where people have medications they need to take daily, but it's tempting to take the whole bottle. So they go daily to the pharmacist, or they only have 2 at a time or a safe amount at a time. So you're taking the means out of their hands. Those are practical things that you can do to keep them safe. And make sure that the person has a way to calm themselves. And that is going to be a conversation with them, co-authoring, collaborating with them. What are the things that you do to calm yourself? Maybe somebody has a bath. Maybe somebody goes for a walk. Maybe somebody just cuddles their dog on their lap. Whatever it is that they do to calm themselves, make sure that they have a way. Let's talk through until you have a way that you can calm yourself. Here's some resources. This is in the Edmonton area. Royal Alexandra Hospital. They have, I don't think it's called the Blue Door anymore, but it is a mental health emergency room. And you can go to that 24/7 and it gets you in touch, it gets you into the place where there are nurses and doctors that specialize in the area of psychiatry and mental health. So that could be a hospital visit. If a person wants to stay with texting, there's a text number. There's a distress line. There's a mental health helpline. There is one there for kids. And then there is our own AHS mental health link. Those are all resources that you can take down, you can write them out, you can have them, and you can say, when things are really tough, tonight at midnight, you know I'm going to be asleep, there's nobody else you feel like you can call this line. Or you can text this number. And there will be somebody on the other end who is trained to deal with this kind of stuff, who can talk you through. And those people will help you with that, get through that thing. In the end, what I want to say is if you cannot feel guaranteed of the person's safety, you can call 911. You can call for an ambulance or whatever. I've heard of people calling the police as well to make sure that person is safe and gets into the care that they want. Ultimately, you just want to know that that person is safe. But in that, you want to do it in an empathetic, collaborative, caring, respectful, and trustworthy way. Not pushing them, not pulling them, but walking alongside them, being with them in their pain, respecting them, and helping them to find their way through with community and support around them. That's how we keep people safe. That's a short bit. Again, if you need to get into this more, if it's more demanded of you, taking a course with Assist in actually getting a good handle on skills is a really good idea. That's dealing with suicide.
Thank you for watching this video on suicide information and prevention. One of the great courses that you can take if you're interested in more on this topic is the ASSIST program. The link for that is down in the description below. Please check that out. And if you or anyone you know is struggling with these kinds of tendencies, please use the numbers below, use the resources that we have listed there. You can additionally contact us by going to our webpage, which is also listed in the description below, so that we can make a plan forward for you in seeking better mental health for your life.